Which bone is known as the collarbone? A. Scapula, B. Clavicle, C. Sternum, D. Humerus. Correct answer, B. Clavicle. The clavicle, also called the collarbone, connects the sternum to the scapula and helps support shoulder movement. The scapula is the shoulder blade, the sternum is the breastbone, and the humerus is the upper arm bone. The axial skeleton includes all except A. Skull, B. Vertebral column, C. Rib cage, D. Scapula. Correct answer, D. Scapula. The scapula belongs to the appendicular skeleton, which includes the limbs and shoulder girdle. The skull, vertebral column, and rib cage are all part of the axial skeleton that protects the brain, spinal cord, and thoracic organs. Which bone forms the forehead? A. Parietal, B. Frontal, C. Temporal, D. Occipital. Correct answer, B. Frontal. The frontal bone forms the forehead and upper part of the eye sockets. The parietal bones form the sides and roof of the skull, the temporal bones are at the sides near the ears, and the occipital bone forms the back of the skull. The vertebral column has how many cervical vertebrae? A. 5, B. 7, C. 12, D. 14. Correct answer, B. 7. There are 7 cervical vertebrae, C1 through C7, in the neck region that support the head and allow movement. 5 is the number of lumbar vertebrae, 12 are thoracic vertebrae, and no region has 14 vertebrae. The longest bone in the human body is A. Femur, B. Tibia, C. Fibula, D. Humerus. Correct answer, A. Femur. The femur is the longest and strongest bone in the human body, supporting body weight and enabling walking. The tibia and fibula are lower leg bones and shorter than the femur, while the humerus is the upper arm bone. Which bone protects the brain? A. Skull, B. Clavicle, C. Sternum, D. Vertebrae. Correct answer, A. Skull. The skull encloses and protects the brain. The clavicle supports the shoulder, the sternum protects chest organs, and the vertebrae protect the spinal cord. The bone that forms the lower jaw is called A. Maxilla, B. Mandible, C. Zygomatic, D. Temporal. Correct answer, B. Mandible. The mandible forms the lower jaw and is the only movable bone of the skull. The maxilla forms the upper jaw, the zygomatic bone forms the cheekbone, and the temporal bone is located at the side of the skull. Which of the following is a flat bone? A. Femur, B. Radius, C. Scapula, D. Tibia. Correct answer, C. Scapula. The scapula is classified as a flat bone, which protects organs and provides a broad surface for muscle attachment. The femur, radius, and tibia are all long bones. The main purpose of the spinal cord is to A. Pump blood, B. Support the rib cage, C. Protect muscles, D. Transmit nerve signals. Correct answer, D. Transmit nerve signals. The spinal cord transmits nerve impulses between the brain and the rest of the body, controlling movement, sensation, and reflexes. Pumping blood is the heart's function, supporting the rib cage is the vertebral column's function, and bones protect organs, not muscles. Which bone forms the shoulder blade? A. Scapula, B. Clavicle, C. Humerus, D. Sternum. Correct answer, A. Scapula. The scapula, or shoulder blade, connects with the clavicle and humerus to form the shoulder joint. The clavicle is the collarbone, the humerus is the upper arm bone, and the sternum is the breastbone. Which bone is commonly called the kneecap? A. Patella, B. Femur, C. Tibia, D. Fibula. Correct answer, A. Patella. The patella, or kneecap, protects the knee joint and improves leverage for thigh muscles. The femur is the thigh bone, the tibia is the shin bone, and the fibula is the smaller bone of the lower leg. How many bones are in the adult human skeleton? A. 196, B. 206, C. 210, D. 215. Correct answer, B. 206. An adult human skeleton has 206 bones. 196 is too few. 210 and 215 are too many, as these numbers do not account for the standard adult fusion of some bones like the sacrum and coccyx. The hyoid bone is located in the A. Neck, B. Chest, C. Skull, D. Hand. Correct answer, A. Neck. The hyoid bone is located in the neck and supports the tongue and larynx. It does not connect directly with other bones. The chest has ribs and sternum, the skull houses cranial bones, and the hand contains carpals, metacarpals, and phalanges. Which bone is part of the appendicular skeleton? A. Vertebra, B. Sternum, C. Femur, D. Skull. Correct answer, C. Femur. The femur is part of the appendicular skeleton, which includes limbs and girdles. The vertebra is axial, the sternum is axial, and the skull is axial. The small bones in the wrist are called A. Tarsals, B. Carpals, C. Phalanges, D. Metatarsals. Correct answer, B. Carpals. Carpals are the small bones in the wrist, tarsals are in the ankle, phalanges are finger and toe bones, and metatarsals are foot bones. The bone that forms the back of the skull is the A. Frontal, B. Parietal, C. Occipital, D. Temporal. Correct answer is C. Occipital. The occipital bone forms the back and base of the skull. The frontal bone forms the forehead, the parietal bones form the sides and roof of the skull, and the temporal bones are located at the sides near the ears. Which bone is found in the upper arm? A. Radius, B. Humerus, C. Ulna, D. Scapula. Correct answer is B. Humerus. The humerus is the long bone of the upper arm. The radius and ulna are forearm bones, and the scapula is the shoulder blade. The main function of the rib cage is to A. Aid movement, B. Protect internal organs, C. Produce blood cells, D. Store calcium. Correct answer is B. Protect internal organs. The rib cage protects vital organs such as the heart and lungs. While it assists in breathing, aids movement, its primary function is protection. Blood cells are produced in bone marrow, and calcium storage occurs in bones generally. Which vertebrae allows rotation of the head? A. Axis, B. Atlas, C. Cervical 3, D. Thoracic 1. Correct answer is A. Axis. The axis allows rotation of the head through its odontoid process. The atlas supports the skull and allows nodding. Cervical 3 does not have rotational specialization, and thoracic 1 is part of the thoracic spine and does not allow head rotation. The breastbone is also called the A. Sternum, B. Scapula, C. Clavicle, D. Hyoid. Correct answer is A. Sternum. The sternum, or breastbone, is located in the center of the chest and protects the heart and lungs. The scapula is the shoulder blade, the clavicle is the collarbone, and the hyoid is a neck bone supporting the tongue. Which of these bones is part of the skull? A. Femur, B. Maxilla, C. Tibia, D. Ulna. Correct answer is B. Maxilla. The maxilla forms the upper jaw and part of the face. The femur is the thigh bone, the tibia is the shin bone, and the ulna is a forearm bone. Which bone forms the prominence of the cheek? A. Zygomatic, B. Maxilla, C. Mandible, D. Nasal. Correct answer is A. Zygomatic. The zygomatic bone forms the cheek prominence and part of the eye socket. The maxilla forms the upper jaw, The mandible forms the lower jaw, and the nasal bones form the bridge of the nose. The vertebrae in the chest region are called A. cervical, B. thoracic, C. lumbar, D. sacral. Correct answer is B. thoracic. The thoracic vertebrae T1 through T12 are located in the chest region and attached to the ribs. Cervical vertebrae are in the neck, lumbar in the lower back, and sacral vertebrae are fused at the base of the spine. The largest sesamoid bone in the body is the A. patella, B. pisiform, C. navicular, D. talus. Correct answer is A. patella. The patella, or kneecap, is the largest sesamoid bone embedded in the tendon of the quadriceps muscle. The pisiform is a small wrist bone, the navicular is in the foot, and the talus is an ankle bone. The part of the skull that encloses the brain is called A. facial bones, B. cranial bones, C. mandible, D. maxilla. Correct answer is B. cranial bones. Cranial bones form the protective case around the brain. Facial bones form the structure of the face. The mandible is the lower jaw, and the maxilla is the upper jaw. Which bone is found in the lower leg? A. humerus, B. tibia, C. radius, D. ulna. Correct answer is B. tibia. The tibia is the larger bone of the lower leg that supports body weight. The humerus is the upper arm bone, and the radius and ulna are forearm bones. How many thoracic vertebrae are there? A. 5, B. 7, C. 12, D. 14. Correct answer is C. 12. There are 12 thoracic vertebrae, T1 through 12, in the chest region. 5 refers to lumbar vertebrae, 7 to cervical vertebrae, and 14 is incorrect. Which bone helps form the eye socket? A. zygomatic, B. frontal, C. occipital, D. temporal. Correct answer is A. zygomatic. The zygomatic bone forms the lateral wall and floor of the orbit. The frontal bone forms the roof, occipital forms the back of the skull, and temporal contributes to the side of the skull. The small bones in the fingers are called A. metacarpals, B. phalanges, C. carpals, D. tarsals. Correct answer is B. phalanges. Phalanges are the finger and toe bones. Metacarpals form the hand bones, carpals form the wrist, and tarsals are in the ankle. The bone that forms the base of the skull is the A. occipital, B. frontal, C. parietal, D. sphenoid. Correct answer is A. occipital. The occipital bone forms the base and back of the skull. The frontal forms the forehead, parietal forms sides or top of the skull, and the sphenoid forms part of the skull base and orbit. The spine has how many lumbar vertebrae? A. 14, B. 7, C. 5, D. 12. Correct answer is C. 5. There are 5 lumbar vertebrae, L1 through L5, in the lower back, which bear weight and allow movement. The bony projection you can feel on your ankle is the A. malleolus, B. patella, C. calcaneus, D. talus. Correct answer, A. malleolus. The malleolus is the prominent ankle bone, the patella is the kneecap, the calcaneus forms the heel, and the talus is the ankle bone connecting the leg to the foot. The cranial bone that contains the ear canal is the A. occipital, B. frontal, C. parietal, D. temporal. Correct answer, D. temporal. The temporal bone contains the external auditory meatus, ear canal. The frontal forms the forehead, parietal forms sides/top of the skull, and occipital forms the back of the skull. The coccyx is also known as the A. tailbone, B. Sacrum, C. Hip bone, D. Pelvis. Correct answer, A. Tailbone. The coccyx, or tailbone, is the small terminal bone of the vertebral column. The sacrum is the fused vertebrae above it. Hip bones form the pelvis, and pelvis refers to the entire pelvic structure. The bone that forms the posterior roof of the mouth is the A. Maxilla, B. Palatine, C. Zygomatic, D. Mandible. Correct answer, B. Palatine. The palatine bone forms the posterior part of the hard palate, roof of the mouth. The maxilla forms the anterior portion of the palate, the zygomatic forms the cheekbone, and the mandible forms the lower jaw. Which of the following is a long bone? A. Radius, B. Scapula, C. Sternum, D. Skull. Correct answer, A. Radius. The radius is a long bone in the forearm that allows wrist movement. The scapula and sternum are flat bones, and the skull is composed of flat and irregular bones. The carpal bones are located in the A. Foot, B. Hand, C. Elbow, D. Shoulder. Correct answer, B. Hand. Carpal bones are the small bones forming the wrist. The foot contains tarsals, the elbow is a joint region, and the shoulder is formed by the scapula, clavicle, and humerus. The bone forming the upper part of the nose is the A. Nasal, B. Maxilla, C. Vomer, D. Zygomatic. Correct answer, A. Nasal. The nasal bones form the bridge of the nose. The maxilla forms the upper jaw, the vomer forms part of the nasal septum, and the zygomatic forms the cheeks. The smallest bone in the body is the A. Stapes, B. Incus, C. Malleus, D. Patella. Correct answer, A. Stapes. The stapes, located in the middle ear, is the smallest bone in the human body. The incus and malleus are slightly larger ear bones, and the patella, also called the kneecap, is much larger. Which bone forms the chin? A. Maxilla, B. Mandible, C. Zygomatic, D. Vomer. Correct answer is B. Mandible. The mandible forms the lower jaw and chin. The maxilla forms the upper jaw, the zygomatic forms the cheekbone, and the vomer forms part of the nasal septum. The point where two bones meet is called A. Cartilage, B. Joint, C. Ligament, D. Tendon. Correct answer is B. Joint. A joint, or articulation, is where two bones meet and allow movement. Cartilage cushions joints, ligaments connect bone to bone, and tendons connect muscle to bone. The appendicular skeleton includes A. Skull, B. Ribcage, C. Limbs, D. Vertebrae. Correct answer is C. Limbs. The appendicular skeleton consists of the limbs and girdles. The skull, ribcage, and vertebrae are part of the axial skeleton. The main bone of the thigh is the A. Femur, B. Tibia, C. Fibula, D. Patella. Correct answer is A. Femur. The femur is the largest and strongest bone in the body, forming the thigh. The tibia and fibula are lower leg bones, and the patella is the kneecap. Which type of bone is the patella? A. Long bone, B. Short bone, C. Sesamoid bone, D. Flat bone. Correct answer is C. Sesamoid bone. The patella is a sesamoid bone embedded within a tendon. Long bones include the femur, short bones are wrist and ankle, and flat bones are scapula or sternum. The skull has how many cranial bones? A. 6, B. 8, C. 10, D. 12. Correct answer, B. 8. The skull has 8 cranial bones that enclose the brain: frontal, 2 parietal, 2 temporal, occipital, sphenoid, and ethmoid. Which bone is also called the shoulder blade? A. Clavicle, B. Scapula, C. Sternum, D. Humerus. Correct answer, B. Scapula. The scapula forms the shoulder blade and articulates with the clavicle and humerus. The clavicle is the collarbone, the sternum is the breastbone, and the humerus is the upper arm bone. Which bone is not part of the skull? A. Frontal, B. Maxilla, C. Humerus, D. Temporal. Correct answer, C. Humerus. The humerus is the upper arm bone and not part of the skull. The frontal forms the forehead, the maxilla forms the upper jaw, and the temporal forms the side of the skull. The main bones of the hand are A. Carpals, metacarpals, phalanges, B. Tarsals, metatarsals, phalanges, C. Radius, ulna, carpals, D. Humerus, radius, ulna. Correct answer, A. Carpals, metacarpals, phalanges. Carpals form the wrist, metacarpals form the palm, and phalanges form the fingers. Tarsals and metatarsals are foot bones, and the humerus, radius, and ulna form the arm and forearm. The skull contains how many facial bones? A. 8, B. 12, C. 14, D. 16. Correct answer, C. 14. The skull has 14 facial bones, 2 maxilla, 2 palatine, 2 nasal, 2 zygomatic, 2 lacrimal, 2 inferior nasal conchae, 1 vomer, and 1 mandible. The vertebral column is divided into how many regions? A. 3, B. 4, C. 5, D. 6. Correct answer, C. 5. The vertebral column has 5 regions: 7 cervical, 12 thoracic, 5 lumbar, 5 fused sacral, and 4 fused coccygeal. How many questions did you get correctly? Drop your score in the comments section and subscribe for more nursing questions and answers.